What is a safety plan? A safety plan is a prioritized written list of coping strategies and sources of support that veterans or anyone else can use who has been deemed to be at high risk for suicide. Veterans can use these strategies before and during a suicidal crisis. The plan is brief. It is in their own words, and it is easy to read. Any veteran or anyone else who may be suicidal should have a comprehensive suicidal risk assessment. Clinicians should then collaborate with the veteran on developing a safety plan. How should a safety plan be done? Safety planning is a clinical process. It's listening to, empathizing with, and engaging the person in the process that can promote the development of the safety plan and the likelihood of its use. There are 6 steps involved in the development of a safety plan. One, warning signs. Ask, how will you know when the safety plan should be used? Ask, what do you experience when you start to think about suicide or feel extremely distressed? List warning signs, thoughts, images, thinking processes, mood, and/or behavior, using their own words. Step 2. Internal coping strategies. Ask, what can you do on your own if you become suicidal again to help yourself not to act on your thoughts or urges? Assess the likelihood of use. Ask, how likely do you think you would be able to do this step during the time of crisis? If doubt about use is expressed, ask, what might stand in the way of you thinking about these activities or doing them if you think of them? Use a collaborative problem-solving approach to address potential roadblocks and ID alternative coping strategies. 3. Social contacts who may distract from the crisis. Instruct veterans to use Step 3 if Step 2 does not resolve the crisis or lower risk. Ask, who or what social settings help you take your mind off your problems, at least for a little while? Who helps you feel better when you socialize with them? Ask for safe places they can go to be around people, such as a coffee shop. Ask veterans to list several people and social settings in case the first option is unavailable. Remember, in this step, the goal is distraction from suicidal thoughts and feelings. Assess the likelihood that a veteran will engage in this step. ID potential obstacles and problem solve as appropriate. Step 4. Family members or friends who may offer help. Instruct veterans to use Step 4 if Step 3 does not resolve crisis or lower risk. Ask, among your family and friends, do you think who you could contact for help during a crisis? Or who is supportive of you, and who do you feel that you can talk with when you're under stress? Ask them to list several people in case one contact is unreachable. Prioritize the list. In this step, unlike the previous step, patients reveal they are in crisis to others. Assess the likelihood that they will engage in this step, ID potential obstacles, and problem solve. Role play and rehearsal can be very useful in this step. Step 5. Professionals and agencies to contact for help. Instruct the veterans to use Step 5 if Step 4 does not resolve the crisis or lower risk. Ask, who are your mental health professionals that we should identify to be on your safety plan? And are there other health care providers? List names, numbers, and/or locations of clinicians, local urgent care services, VA Suicide Prevention Coordinator, VA Suicide Prevention Hotline, 1-800-273-TALK, 8255. Assess the likelihood the veteran will engage in this step, ID potential obstacles, and then problem solve. Step 6. Making the environment safe. Ask veterans which means they would consider using during a suicidal crisis. Ask, do you own a firearm, such as a gun or rifle? And what other means do you have access to and may use to attempt to kill yourself? Collaboratively identify ways to secure and limit access to lethal means. Ask, how can we go about developing a plan to limit your access to these means? For methods with low lethality, clinicians may ask veterans to remove or restrict their access to these methods themselves. Restricting access to highly lethal methods such as firearms should be done by a designated responsible person, usually a family member or a close friend, or maybe the police. What are the steps after the plan is developed? Assess the likelihood that the overall safety plan will be used and problem solve with them to identify barriers and obstacles to using the plan. Discuss where the veteran will keep the safety plan and how it will be located during a crisis. Evaluate if the format is appropriate for the veteran's capacity and circumstances. And review the plan periodically when the person's circumstances or needs change. Remember, the safety plan is a tool to engage the person and is only one part of a comprehensive suicide care plan.